to bring in my good friend, Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, with us this morning. Good morning, Dr. Joe.
Hey, Ray. How are you?
I'm doing well.
Good.
Okay, you want to approach back pain today.
One of the most common things we see.
It's ended many careers.
It has ended many careers, and on the other side, it can be milder and early. So it's across the board, and there's so many different things you can see. So let's talk about, there's really 5 different ways you can approach, and this is my lecture from my office that I've given, I don't know how many thousands of times in 31 years. Chronic recurrent back pain. You've worked it up. There's nothing bad structurally going on. What do you do for people? Number one in the 5 areas of what we can do is medicines. Medicines really are falling out of favor a lot more, and medicines in the long run for my athletes, not a good option. And non-steroidal anti-inflammatory medicines have heart issues and GI issues. So in the long run, many people have tried meds before they've seen us. We know the problem with pain meds and narcotics in this day and age, so those aren't on the board very much. But medicine's number one. Number 2, physical therapy. Physical therapy for my younger, healthy athletes is usually where we start. And physical therapy involves exercise therapy, balancing the muscles, working on the core, but also things like stim and ultrasound and taping, all these different types of taping, dry needling, cupping. There's always new techniques that are done in physical therapy to try to get people with mechanical back pain or chronic back pain better. Number 3, manual therapy. Manipulation, mobilization, deep tissue massage. Sometimes on our sport medicine team, we have to have good chiropractors or osteopathic doctors that do good manipulation or mobilization. And for certain problems that we know, manual therapy and a chiropractic treatment can help greatly. Number 4, when this has gone on a long time, a newer area of medicine in the last 10 or 15 years, chronic pain. There's a lot of docs that are trained in chronic pain now, anesthesia docs who went into chronic pain, and they roll injections, trigger point injections. They may do acupuncture. They may do some of the newer medicines to try to get this under control. Typically after 6 months or a year or more when we start looking into the chronic pain realm. Number 5, surgery. Luckily, in our town, we have some great surgeons, especially in my young athletes. I don't want them to have to see the surgeons, but occasionally there's still indications. I would tell you in the 30, less and less people in my clinic, young athletes, fit the indications to need surgery, but they do sometimes. And there's certain types of discs with leg pain and other issues related to back pain where it's the right thing to do. And in our town, we have several excellent spine surgeons to choose from for me to refer them to, but a handful of people in the sport world may need surgery. So somewhere in those 5 things are the answer, and which one would be most helpful at this time for this athlete?
Most back injuries, wear and tear and use through the years, or is some of that heredity, or is it all of the above?
It's all of the above, and you hit the nail on the head. So people who tell me that, gosh, my father has been through 2 or 3 spine surgeries before me and other issues like that, hey, that there is some hereditary component, genetic component even to that type of makeup that might put you at risk. Definitely the overuse world. And as kids train at higher levels in weight rooms to push the edge of being the best they can be, do not get me wrong. I'm not here to say don't go in the weight room as a young athlete. That's ludicrous in this day and age. To be the best you can be, you spend time in the weight room. As kids push the envelope, or our younger athletes, or our middle age, 20s, 30s, 40s kids are in the weight room a lot more, even adults in the weight room a lot more. The wear and tear of being in the weight room is a big thing. Being on the field repetitively over and over is a big contributor to back pain as well.
The athletes are spending a lot of time in the weight room. And so like you said, there's a lot of positive to that, but also using the back more and more and more in that type of athletic arena, I imagine contributes to more and more back problems.
It does. And when I make an initial referral to physical therapy, and I know the best sport therapists in town, my initial referral is I want to get them on a program that's going to help them build up their back to protect and support it through sport activity. And on the flip side, I want to stay away from things that could make it worse. So I kind of have the physical therapist on the first day go over do's and don'ts in great detail with athletes about what to eliminate right now because it could make your back injury worse, and what to accentuate because it can make your back pain better.
If we're talking to some folks at home right now, certainly seniors or 55 plus, Joe is right. My back is starting to hurt. Are there some things at home, physical therapy, that they can do in the living room, on the porch, in the backyard, maybe to get them going down the right road, whether stretching, exercises, or something?
Absolutely no question. And that's why probably of those 5 things that I talk about that are useful, physical therapy is near the top of the list, because they can teach you a good program you can do and get you doing it at home on a regular basis for a short period of time, turn it over to you, then you continue to do it. The issue is people aren't the greatest at continuing to do those things when they're not. And the other issue is people wait too long to where exercise therapy and physical therapy may not be enough to get them over the hump. And that's when we start looking at our pain clinics. We have some great pain clinics in town and people that help us in that world, but that's not ideal. But those are people that maybe missed the window early on when they could have been on a good program that included a good home program. And now they've progressed further than that and they need further treatment like pain clinics or even surgical options.
Dr. Joe Congeni with us, 1590 WAKR. Joe, I thought it might not be a bad idea to bring this up again. First week of the NFL season is behind us. There was a couple of ACL injuries over the weekend where resulting in players being done for the year. And then we saw Aaron Rodgers on Sunday night get an MCL sprain, is what they say. And he left the game in the first half, and he comes back in the second half, plays brilliantly, and then there's a good chance he's going to play this week. I thought it might be a good time for you to go into the sprain, tear, MCL, ACL, because a lot of people will hear knee injury. How's this guy able to play? Most knee injuries, he's out for a year.
Right.
There's a big difference in the categories there and in its tendons.
There is, and there have to be people, and often it's in the high school setting, the certified athletic trainer, the trainers that help people make decisions of what you can play from and what not. Now, gosh, Aaron Rodgers is just totally amazing, some of the things he does, and so he sets the bar pretty high. But I venture to say last week on many Friday night fields in soccer and football, there were people playing with injuries as well, too, that maybe didn't get as highly publicized or seen by as many people. So there are times. The MCL certainly is one that you can play with, particularly in grade 1s and 2s. Now, his seemed to be probably into where it appeared there was probably some tearing of the MCL. So that's a grade 2, a partial tear. A grade 1 is a stretch to that injury where it bruises and swells, and you can deal with that with taping and other things. A grade 2, when there's a partial tear, if you absolutely can't push off and run and use the leg at all, we typically say, hey, you're not going to help a team and you're not going to be able to play. Well, Aaron Rodgers threw that away because he actually basically looked like he was playing on one leg. But that was something that was really very, very unique. So having some input from your certified athletic trainer or your doctor, if they're there, helping make those decisions. But MCLs with a partial tear, mild partial tear, there are people that play with bracing and other things that we do to try to reduce the swelling and get the range of motion back. ACLs can be very subtle, and there are some people, and you'll hear about it every year, who play with mild ACL, with an ACL tear, which maybe there are some that are not complete. With the ACL, different from the MCL, we say if it's at all a significant tear, it's the same as a complete tear, and you're not going to be able to push off and continue to play, and you're going to need surgery to go on from there. So that's what makes ACL such a big difference from MCL. People do play and come back from MCL. A lot harder to do that with an ACL tear.
I also saw in baseball that the young Japanese player Otani with the Angels, they're recommending Tommy John surgery for this guy to pitch again, but they're saying it's okay for him to continue to bat and play. And then I saw a quote from some people in Major League Baseball that said, yeah, when you need the Tommy John surgery, pitchers will tell you there's not a lot of pain except for when they're pitching. They can do a lot of other things. Is that true?
Absolutely true. And your audience knows that. We've talked about that a little, that in other sports, people with a tear of that UCL, like an ankle sprain or like any other sprain of ligament, you'll lose some of that stability on the inside part of the elbow. But to play another position, you can certainly get by. To play at the plate, definitely can get by. It's only the unique nature of throwing a baseball 85, 90, 95 miles an hour, that you need the stability on the inside of the elbow. And without that, your effectiveness just drops off dramatically. So to be a pitcher We're talking Tommy John surgery. To play a field position, no doubt about that. We very frequently rehab people and get them back out to play with UCL injuries in a whole host of sports, not just baseball.
Interesting. Good stuff, Joe. Good seeing you again. Right. Thanks for making time for us.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.